Welcome everyone. Today we are going to have a conversation about the intersections of mental health and LGBT plus people in the Indian workplace. I'm joined today with two experts who will join us and speak to us about mental health and well-being and how you can navigate your journey, learn more, and make an impact in your life. Before we go ahead, a quick introduction. My name is Rashmi Vikram. My pronouns are she and hers. I am an independent Jedi, that is a justice, equality, diversity and inclusion consultant. I work with organizations in their D&I journeys. And I also work with individuals who are trying to navigate and understand more about DEI. And as part of this process, I'm also working on a leadership development program where people aspiring to join or be in the DEI world can join us and learn more. I'm going to quickly introduce you to the other two speakers who will join us. I would like to invite Dr. Avinash De Sousa to quickly introduce himself.
Hi, this is Dr. Avinash De Souza. My preferred pronouns are he and him. I am a psychiatrist by profession, also a therapist, and I like to call myself an ally of the LGBTQ plus community. I have my clinic at Santa Cruz West, and I am very happy to be here because this is mental health issues in the community are something that I've been working with for the past few years and very close to my heart. Thank you for having me.
Thank you, Dr. Avinash. And it's really important that we work hand in hand with doctors in this space. So welcome to the session. Deepak, a quick introduction from you, please.
Hello, everyone. My name is Deepak Kashyap. My preferred pronouns are he and him, and I am a psychotherapist. I've been a counseling psychologist for over 11 years and a DEI expert for over 12 years now. I technically Indo-Canadian now. I live in Canada. I work both in India and in Canada with the organization called Lotus Mindfulness Center. And we've been working in D&I spaces with all sorts of companies, from energy companies to NGOs to schools and colleges. We've worked with diverse group of companies in diversity and inclusion, and just making sure that people understand the importance of diversity, and it doesn't just become another subsection that the HR is allowed to do, or HR is straddled with this responsibility. So we've been trying to do that, and our expertise sort of lie in transformation management, our expertise lie in workshops, our expertise lies in a whole lot of procedure and policy reviews. So that's what I do.
Thank you, Deepak. And it's so interesting to see the different interventions and ways in which you've gone into while looking at DEI, mental health, and working with both corporates as well as the NGO sector. So I'm going to be very keen to understand a lot more about some of the journeys that you've had, your adventures over here, and I'm sure the anecdotes will also help us learn more about some of the do's and don'ts. Now, when we come to the topic of the conversation at hand, when we talk about mental health, some of the things that I've noticed right from the beginning of my career in this particular journey when it comes to mental health and well-being, I was introduced to this at my previous organization, Community Business, where we looked at it from a perspective of what does mental health actually mean? How does it impact people? And that's when we realize that mental health is as important as your physical health, right? Because many a times if your mental health is out of sync, then it can affect your body as well. So the brain and the body is interconnected. So it's as simple as that. And I think that's the crux of the whole conversation of why mental health and well-being is so important to all of us. Now, when I connect this to LGBT plus employees, one of the things that we constantly talk about is, creating spaces where people can bring their whole self to work, or how they can represent themselves authentically. When we even talk about this, it means that the mental health and well-being of that individual needs to be at optimum, because otherwise they're actually covering themselves or hiding their true nature and being someone else, either at the workplace or at the social setting. So I get the point that it's so important for us to focus on that. But I also see that there are a lot of barriers that we see around us, and I'm sure Dr. Avinash and Deepak, you would have seen a few of them, like the cultural barriers. People find it so difficult to come out and speak to you, or it could be limited resources. They don't know who to reach out to, or if there are anybody who can help them out. Or it could be just the fact that they don't have enough funding to actually go for help and understand the whole process holistically, rather than just assuming one session would cure them of the challenge that they're going to. So I think those are some of the things that go into my mind. But coming to the current situation, I wanted to ask a question, and this is for both of you, Dr. Avinash and Deepak. If you look at the current situation of COVID-19, and when we see the intersection of COVID-19, individuals' identity, and then mental health, what are some of the things that you are seeing on the ground, and what do you see as challenges that people need to overcome to come out of these?
Doctor, did you want to go first?
No, you go first.
Yeah. Well, I think some of the things that you've mentioned are very, very interesting. First of all, the general understanding of mental health within the country is far from being optimal. And far from being like, hey, we understand that even the difference between mental illness and mental health. Mental illness is something different and mental health is something different. Mental illness is something that's diagnosable, that you can sort of identify. Mental health is on a range of flourishing or languishing. Whether you are flourishing as an individual, whether your own behavior works for you, but it's not a diagnosable problem. A diagnosable problem, and that's the reason why we don't even approach people, because मैं पागल थोड़ी हूँ, मुझे illness नहीं है. So the idea is to understand that mental illness and mental health are two different things. Mental illness allows the problem to be attributed to illness, not the person, or not the person's behavior. I mean, yes, sometimes you could have a mental illness, but still have a reasonable mental health. For example, I could be suffering from schizophrenia, but I have enough support, I have enough knowledge of what I'm doing, I have medication, and my attitude towards schizophrenia is not one of, oh my God, ye kya ho gaya? So I could have good mental health while having a mental illness. So this distinction is important. And then I think it is important to look at numbers. WHO in 2019 and in 2020 has just announced India to be one of the most depressed countries in the world, with 43% of the population experiencing some or the other symptoms of depression, 11% having severe depression, and 6% needing to be hospitalized because of depression. So I think we need to stop looking at the way we project ourselves on our tourism brochures of incredible India, of being like, hey, we are this kind spiritual country, we are enlightened. You're also one of the most depressed countries in the world. You're also the country with one of the highest rates of suicides in the world. And most of the people dying of suicide are between the ages of 15 and 45. So these are some of the things that you have to keep in mind before you even start talking about a subsection of that population. Now, the subsection of that population is stigmatized already, won't be able to open up to their healthcare provider, whether they are mental healthcare provider, or their sexual healthcare provider, or they're just general healthcare provider, right? So obviously there's going to be such, and for example, a lot of HRs within companies have EAP, like they handle EAPs, right? The employee assistance programs. I handle a lot. I'm on the giving end of EAPs, right, to a lot of HRs. And if the HR is not, if the HR is one, not an ally, or not a conscious ally. Let's say they're not they're not like an enemy, but they're not a conscious ally, like Dr. De Souza here is a conscious ally and claims to be a conscious ally. You cannot claim to be a conscious ally or a gay supportive if not more than 10% of your clients are gay. In Canada, a lot of the times people want to come and like, hey, I'm gay friendly, give me your business, look at me, I'm going to use these rainbow colors during Pride. And no, hang on a second. How many of your employees are openly gay? How many of your employees feel supported? That's what makes you a gay friendly business. Not just your claim in a vacuum. And that sort of doesn't do it. So I think awareness is definitely the key. The difference between mental illness and mental health is the key. And to identify that there are actually cultural ideas that are very supportive of mental health if applied properly, which we can talk about throughout. But yeah, I'm curious to hear what Dr. De Souza has to say.
Yeah.
Sure.
Well, I think in my personal experience, what I have witnessed during this entire lockdown pandemic situation is that a lot of members of the community sadly have had to put up at home, work from home, remain at home with, I think, unfriendly and quite homophobic, if I may use the word, family members and relatives, and they've been very disturbed about that because many of them haven't come out to even their own families. Many of them haven't come out to even their own, I would say, people staying with them. And suddenly they've had to converse with friends online. They've had to have their social life online. And so, and this has very often led to some kind when they've had people eavesdropping, overhearing them. And this has, caused a huge sort of turmoil to them. Some of them have used this time to try and come out to their families. And what has happened as a result of that is that there has been anger, shock, violence, aggression, denial, even, threatened coercive treatments for their problem by the family members. And sadly, only 1% of family members have probably shown acceptance. So many of them have, booked online sessions that please explain to my family members that I've come out in good faith, and coming out is not, it's not a disease. Please, try and explain to them it's not a problem. It's not criminal. And I have not brought the family name to disrepute. That's how Indian culture works. So, so very often I've had to do a lot of these psychoeducation sessions. And, and I don't mind saying this. Though I say I'm a conscious ally, I've had a number of parents ask me, whether I belong to the community and why am I being so supportive and why am I being so, positive and trying to help their kid, very often because they think probably I also probably, belong there. And I've told them, no, I'm a doctor. I understand this scientifically. And that's how I'm, sort of explaining this to you. I've usually, I think, and then they've been very open to their children seeking mental health help. But the child or the young adult has sought help because he wants the family to be supportive. The family has brought him to me thinking that I will help him overcome his LGBTQ plus tendencies.
Oh yeah.
Yes,
always.
Always. So, that's the huge dichotomy which exists. And yeah. I think, and as Deepak, as he mentioned, mental illness versus mental health, there's a whole different paradigm. Because see, they'll still go to Deepak because he's a counselor. They'll feel he's only going to talk to them or advise them or whatever. But when they look at me, you're a psychiatrist. into brackets, Pagaloka doctor, I mean, in India. So, I'm not mad to go to a psychiatrist, or, is my child mad? We don't need to go to psychiatrist. So they would go to a counselor first. So that would generally be their approach. But then very often, by the time the person comes to me, he's already been through a lot of trauma, a lot of depression, a lot of, and one thing which I will just add here is that it's something I have said over the past 2 decades of my work, that, everyone comes to me after the problem. So people come to me, afterwards, that I am depressed now, I am anxious now, this has happened, and I'm getting panic attacks. I always say we get our physical health checkups done every 6 months, every 3 months. I've never had a patient walk into my clinic and said, I've just come for a regular mental health checkup to see, whether there's something wrong with me or not. I don't think I have a disorder, but I've just come here to check, and that has never happened, sadly. So I'm waiting for a day that, mental health checkups, physical health camps happen, blood pressure camps, diabetes camps, orthopedic camps. I mean, but we've never had mental health camps happen, that, people from the community just walk in to see how stressed they are. No. So I think that is a day I'm waiting for. Probably.
And it's sort of harder even to have those measurements. We don't have a BP instrument, for example, for mental health, and it's largely self-report. It's so I think
that's another thing. Do you have a blood test? We don't have a blood test either to prove to them that you're depressed, or you can say your sugar is 300, it's high, but we don't have anything on the mental health spectrum, from a blood test to an MRI to anything physical as a parameter to show them.
And we are a culture of what we call in Hindi pratyaksh. That means if it is visible to you, it's real. It's real only when it's visible to you. But we believe in all sorts of things that are not visible to us, right?
that is so true.
Right? So we do have a culture of pratyaksh, and I think all mental health experts will have to keep that in mind. Like, they will get frustrated if they don't understand the culture of pratyaksh. That we literally, that's what we work on. And I think Dr. De Souza raised a really important point, is that we had to quarantine with queerphobia for a lot of the time. That this whole advice of stay home, stay safe. Well, home wasn't safe for a lot of queer people and for women. The domestic abuse rate have gone up by 200%. Women who get beaten up, like the intimate partner violence, it's not just women who are getting beaten up, but overwhelming majority, it's women who are getting beaten up. And queer people are getting beaten up by their intimate partners or their loved ones and things like that, and people around it. So I think this idea hasn't worked for us. Second thing is that a lot of us used to go, for example, if you're going to take Bombay as an example, or Bangalore as an example, just these weekly or fortnightly meetings where we could just see other gay people, where we could see other queer people, smile at them, where we didn't have to worry about, oh, is my hand too limp, or is my smile too gay? Is like what, where I didn't have to worry about any of these. It was just so nice. But we obviously cannot do that, right? So a pandemic has had a specific and a special effect on the mental health of the queer individuals.
Yes, I agree. And thank you so much for sharing that, Deepak, right from the beginning on talking about the difference between mental illness and mental health. It is so important because just recently there was a neighbor who came up to me and wanted to speak to me in hushed tones, talking about how her son came out to her and spoke to her about his challenge with anxiety. And for her, it became a huge burden, and she wanted to kind of talk about how difficult it is when somebody goes through this in the family. And she kind of made it more of a disease that this person is never going to come out of, and how it could be something that is transferred to others in the family. So it shows how much we understand mental health and the challenges associated with it. And what Dr. Avinash spoke about specifically around the education of families, it's so important. And we hear a lot being in this space. When I started my journey in 2010, speaking about LGBT plus in my workplace, there were a few people who even thought maybe I'm bisexual. I couldn't be lesbian because I was married and I had a child. So I had to be bisexual because that was the only way they could peg me into a group, because otherwise there was no reason why I should be going to a pride,
We would
pride
have been
rally.
happy with both of you joining the community.
I know. Yeah, but I think that's the common aspect of how people want to put you in a bracket, so that it's much more comfortable for them to feel that, okay, this is the reason why you're speaking about a particular community, etc. So I think that's really important for us to understand, and how to educate parents and caregivers and partners in this journey, because otherwise without support, this is not going to go anywhere. I'm going to go to a very direct question, Deepak. As a gay man, as a mental health expert, as someone who's seen challenges, from all aspects, be it corporate as well as in the non-corporate world, what are some of the common challenges that the community battles with? What do you think, if I ask you just list out 5 out of the 100 that you see, what would that be?
Oh, 5. Okay, well, the first is the emotional burden of educating the others. Like, now it's my emotional burden to come and tell you about me. And especially in a tone that is going to be apologetic, that's like, hey, by the way, I'm a little hesitant. I hope you don't mind. I'm gay. I always tell people never to apologize when they're coming out. Show concerns about other people's feelings. That, hey, you know what? This is a bit difficult. Do you want to sit down and let's have a chat about this? However, I'm not showing any guilt or apology in my tone. Okay? So that's one. That there's an emotional burden, and it is there. I mean, there's nothing that you can do about it. I mean, there was an argument that people said, like, well, people go to, cricket games and they learn about the cricket game, which is going on. They learn about the rules of the game before they go and watch the game in the stadium. And I'm like, but the cricketers are not out in society asking for acceptance. They're already accepted, right?
They're over-accepted.
They're over-accepted. You, on the other hand, are going around asking for people to change the way they think to accommodate you, right? So there is that burden of that emotional labor that one has to go through. And it's never ending. As soon as the context changes, you have to come out again, right? It's not like, I mean, yes, the easiest thing would be I just wear a shirt that says I'm gay. Do you have any questions? But that's probably not going to be a most appropriate thing to wear in an office. The second thing I think people go through is just the resistance that comes after. Fine. I had to overcome the resistance of understanding myself and then coming out to you, crossing that barrier, and then you showing your own resistance. The third thing is that the jokes, some of them are not even funny. Like, it's just calling names, it's just asking insensitive questions and blah, 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 blah. And the fourth one I would say is actual discrimination. It's like, hey, I've accepted you, but I do not want you closer to my team or like, this has happened to me a lot. I've been on television talking about being gay since I was 20 years old. A long time ago, but since I was 20 years old. And it's very interesting. A lot of my relatives have accepted me, but when it comes to their own kids, or, recently one of my cousins got married, and it was very apparent that her mother did not want me anywhere close to the relatives because they are these English-speaking elite of the country who would quickly know who I am, and so it's those things. So the active discrimination, right? Day-to-day discrimination. And then the actual exclusion from, real policies around promotions, around, assignment of work, around what am I expected to do or not do because of being queer, because of being gay. So policy, day-to-day day-to-day discrimination, policy exclusion, then and the actual harassment, resistance, and the emotional burden of coming out. I think these are some of the main important ones as far as I'm concerned.
Thank you for sharing that. I know that's a huge burden to share, and big hugs to you for sharing with us. And I'm sure some of the listeners would also be reflecting on the points that you just made. Keeping this in mind, I'm just going to ask Dr. Avinash, who's been working in this space for a number of years, both in the in a sector that's organized, as well as through his own foundation and the work that he's done. So Dr. Avinash, how has the attitudes of the community themselves changed towards mental health in the last couple of years? And have you seen that move or a direction towards which people are going when it comes to stigma-free access to mental health? Is there something that's been done consciously to kind of engage with this?
Yes. So I think one is that I feel members of the community I have found now know that, there's a certain subset of mental health professionals who are there for them. That's one good thing. And the word spreads. The moment you probably treat or manage one or two, they go and tell 10 others, and the word spreads exponentially, and then they come to you. Now, I think if not mental health, at least the acceptance of going to a psychiatrist is something which has definitely come in that, okay, I don't mind going to a psychiatrist. Whether to take his treatment or not, I'll decide later, but at least I'll go and see him. There's no harm in seeing him. So they don't mind coming and seeing us. That is the first change that I've seen. The second change that I've seen is that I always say this, that even within the LGBTQ plus community, there are two subsets of mental health problems. So one is, you have depression, anxiety, just like you and me may have it. They're also human. They'll also have it in the same way. Only there may be factors which are also specific related to their LGBTQ plus status, etc., family around them, that may add to it. But the overall management, the biochemistry, the biology doesn't really change in a very big way, except for the factors that, may contribute to causing or precipitating the mental health condition. That also, not all the factors are different. Many of the factors are similar, but you will have some changes which are there. Now, the third major change that I have seen is that I've had mothers, or I've had one parent, or I've had a sibling that's come and said, my family will not understand him, doctor, but I will stand by him. Which I think has been a very heartening thing, that there's been one member of the family, either a mother or a sibling or a father at times, saying that my wife and her family may not understand, my brothers and sisters may not understand, but he's my son, so I will stand by him the way he is. And, I will see that he follows up and see that he comes. And, can you give me a book where I would like to read about the terminology used, so that I sort of learn and brief myself and whatever. So this is something which I think plays a very important role. And I think the fourth thing, which also is, I think, plays a very, very important role, is that when you have organizations which are LGBTQ plus friendly, from an HR perspective, from an employment perspective, a lot of people seek mental health help rooted via the organization because they feel secure. And they also feel secure because the organization is referring them to me. So they feel it's not that they've come directly and, something untoward may happen. They're going through the organization. And that's especially if, as Deepak said, if you have an HR which is consciously an ally, they're aware and they know, then it works in a very sort of big way. And I always tell people that, one thing we need to do is that we need to make mental health a household name. I mean, if you look at it today, cardiology or a bypass surgery or an angioplasty, it's a household name. It's like a status symbol that I've undergone an angioplasty or I've undergone a bypass surgery, that way. So we need to give that same glamour to mental health, which isn't there. And we sat, and I remember in a school I had a young girl that came to me and said, I'm upset because I'm being bullied and they're calling me a lesbian. And I said, what's wrong with that? 2% of the world is lesbian. There's nothing wrong in being one. And she said, so I said, what are you hurt about, the bullying, or you're hurt about being called a lesbian? I asked her, what hurts you more? So I said, if let's say they called you dark or fat or stout or whatever, I mean, would that affect you less? Or, so they said, no, I mean, I play basketball, I have a little masculine kind of structure. So, so they're calling me lesbian in that sense. So I said, the fact is, you look at being lesbian as abnormal. If you look at it being normal, then the bullying won't worry you. I said, so it's, the key thing is we are in a society which is sadly heterosexist, homophobic, and patriarchal. So, I said, and that's the reason why these feelings are put into us from a very early age, and we are still sadly in a society where, faith healers are called upon to get rid of LGBTQ plus tendencies, and pujas are done and yagyas are done, and also yes, all sorts of things are done. That they use the word tendencies, that he's probably, there's something within him that is a ghost or something that's making him go in all this wrong direction. So and I think the metros are still opening up. Whereas I think there's a huge proportion, and I think Deepak may agree with me, we have a huge proportion of members of the LGBTQ plus community who are in tier 2 and tier 3 cities and who don't have access to good mental health care. So, for example, if let's say I belong to the community and I was in a place like Raipur, or I was in a place like Bihar, or I was in a place like Lucknow, would I have a psychiatrist who is an obvious ally? Very few. Very few. Yeah.
And I think, and being an ally, you have to understand this specific, and I'm glad that Dr. Avinash sort of touched on it, that the biochemistry of depression might stay the same, but the onset and the triggers are different, right? One thing that when you're dealing with the queer community, the LGBTQ across the board, look for shame-based trauma. Most of us have spent our young adulthood in shame, in trying to hide, lie, come across as someone whom we are not, right? So we've done all of that. And what that does is a lot of shame-based trauma gives us, for example, very little ability to make relationships and have sustainable relationships. And that's why when you look at queer people and you're like, oh, well, I haven't seen two gay men in a relationship for a long time. It's because that's the symptom of shame-based trauma. I mean, that's one part of it. Well, the other part of it is that there is very little social support. So, and the other thing I think you were talking to me about, was referring to, like, if someone's bullying you, calling you queer, and if you think being queer is bad, then of course it's going to hurt you more. It's like someone calling me, hey, tu to vegetarian hai. Acha, tu, like, what's wrong with that? Right? So, hey, tu to lesbian hai. So, like, okay, and your point is? So that's the kind of attitude that we'll have to sort of develop in people.
Yeah, thanks for saying that, Deepak, to help people build that attitude. And I think we need to start a lot more, like, right now when we talk about mental well-being or looking at it from perspectives of employers or employees, we're talking about it from the perspective of a workplace. But from what Dr. Avinash is saying, and from your point as well, Deepak, it's very important that right from school, it should be something that is made accessible. It should be made something that you kind of remove the taboo out of the term, to help people be more, open to even speak about it. Like, say, for example, if someone were to ask me what are some of the things that we could do to foster mental well-being in a workplace or in a school, one of the first things that I would say is to have an in-house counselor, or to have services that is accessible to everyone, and you communicate it to everyone. So if it's a school, you communicate to all the children that there is a resource whom you can reach out to, and this individual will be the person who can provide support to you, or
And
to an
also,
organization
yeah,
as well.
and also
Yeah.
not make sure that you're not making your LGBT employees feel like they're a burden. Like,
Yes.
ab ye bhi karna padega yaar. This is naya drama.
Yeah.
Why
Yeah.
can't they just like, I'm not bringing my sexuality to work. Why is he bringing his sexuality? Hang on a second. If you're sitting down on lunch and you're saying, ye meri biwi ne banaya hai, and I've just dropped my child, you've admitted to having sex with your wife once at least. That's all I want. I'm not coming to work telling you whom I hooked up with. That's not the kind of sexual details. It's not about sexuality. Sexuality is not something that you can take off, divorce from yourself, and leave at home.
Yeah.
Sexuality is carried around. And the second thing that's important to remember is that at what point are my traditions going to be like, "Arey bahut ho gaya yaar, development chodo abhi." Like, we've reached a point where we don't need to evolve anymore. Like, imagine, can I look at a woman, Rashmi, and go, "Abhi mil gaya na tumhe right to vote? Enough. You can work, no? Enough. Why do you want equality now?" And so when will we reach that point where we'll be like, we've become socially enlightened. There's no more room for involvement. There's no more room for, development. Hang on a second. Just because ask yourself that question. Why is this annoying me? What privileges do I lose?
Yeah.
When it is given to someone else? So that's the question that was asked by Emily Davidson, who is fighting for women's suffragette, is that when women get a right, why do men assume that men will lose it? We're just saying we want it as well. Rights are not limited resources.
Very true.
Respect is not a limited resource. So I think that's what we have to sort of also look at.
Yeah, Deepak, and I think we have to make the distinction between equity and equality and ensure people understand why equity is so important right now, all around us. And, when I'm just looking back, the first time we had the RISE conference here in Bangalore, and there was a job fair. And there were a lot of, probable employees coming up to the companies who had set up booths, trying to give out their job descriptions, etc. There was a senior gentleman who came up and he asked me, I want to know where the company booths are. And I asked him, "Sir, do you want to apply for a role?" And he said, "No, I want to know what kind of benefits companies like these are providing to children like my son." And that's when I realized that he's here because he's a parent of a child who is from the community, and he wanted to first test it out whether companies are ready to accept his child, right? So I think it's important that companies make that statement that what do they do to foster a place where everyone is accepted for who they are. They can bring their whole self to work, and it could be even talking about their EAP policies, or if there's any other accessible policies that need to be given. So, Dr. Avinash, if I ask you for, to even list out what are some of the things that companies need to focus on when it comes to creating a space for mental well-being in the workplace, what was it that you would suggest them to do?
Well, I think all the employees should be first sensitized with regard to mental health issues, and even with regard to, I remember taking sessions just on LGBTQ plus terminology, so that people are aware, so that when they converse, they don't offend anyone inadvertently. It's very important that they may not intend to offend, but just because they don't know, they shouldn't end up offending. So that's one. Secondly, it's also very important that everyone from the top brass of the company to the lowest rung, that is even the peons, are sensitized. It's something which is very important, and it's not just the colleagues, or it's the entire company that is sort of sensitized to mental health, to LGBTQ plus terminology and issues, and mental health and LGBTQ plus, all three together, because all three are interlinked. So that's one. Thirdly, I think you should have open forum discussions within the company with regard to mental health. So I always say maybe a once a week, 1 hour discussion on depression, anxiety, sleep, LGBTQ plus issues. We don't want to make it exclusively LGBTQ plus, but mental health in general. And of course, LGBTQ plus issues could come up there. The employee who belongs to the community must feel safe and secure to open up and speak there. So if you start with a neutral topic like mental health or depression or anxiety, he may feel secure first to start speaking there rather than go on to more difficult topics. I also think that it's also important that companies and organizations invest in mental health, which they don't. So when I mean invest, I always say that it would be, they should have, even if they don't have a counselor who's full time, not every organization may be able to do that. If they have someone who can come in once a week and they have something wherein they have employees, they have like a cafe where the employees can sit and talk to this counselor, or they have like a mental health space within their company. So a garden where they can go sit and ideate, or maybe just a terrace where people could sit and think, or a small place if you want to do yoga in the afternoon. I mean, these are small things which go a long way. If nothing else, have a whiteboard, let people randomly write their thoughts on it, and at the end of say 1 month, and one of the things which we've started in some organizations is that we administer a happiness questionnaire and to employees, and employees who score low on that are very often spoken to individually as to what is making you unhappy. Is it the organization? Is it your personal life? And then they are exhorted to seek help. So that's something which is done. And so month by month, we see whether our organization is becoming happier or sadder. And and if it's becoming sadder, then we have a group program for the organization itself as to why do you think this is happening. So I think that's one. And lastly, I think there's also, every employee is given a list of professionals who he can contact, either through HR or individually, and all he has to do is mention that I belong to this company, and say the charges would be borne by your company, at least for the first few consultations, till probably you get better and get on track, and then you may be asked to manage things on your own. So there are organizations where I know they bear the cost for, I think, the first 5 or 6 therapy sessions also. And they say once, we make sure he comes 6 times, then enough rapport is built, he's going to come to you again. And then post that, they pay 50% of the cost. So at least it's some initiative for the person to seek help. Yeah.
Thank you, Dr. Avinash. And I think that's really important for us to know that there are different ways in which organizations can support individuals. And looking at the time, we've had a really wholesome conversation covering a lot of topics. Before I close the session, I just wanted to invite Deepak to kind of give us a few closing comments, anything that we've not discussed that you want to close out.
I think Dr. De Souza has covered everything, and so have you. I don't think I have anything else to add to it, other than just remember, respects and rights are not limited resources, and that's one thing that you take from me.
Thank you so much, Deepak, and thank you, Dr. Avinash. I really learned a lot, and I was able to share some of my thoughts as well. So thank you for the opportunity. And thank you, Pride Circle, for organizing this fantastic program. Thank you.
Thank you.